Today we take a look at two recent papers on this topic that come to similar conclusions. The first is a research article published in British Journal of Sports Medicine. It's titled, Muscle Strengthening Activities Are Associated with Lower Risk and Mortality in Major Non-Communicable Diseases, a systematic review and meta-analysis of cohort studies by Japanese researchers. The research shows 16 studies met the eligibility criteria. Muscle strengthening activities were associated with a 10 to 17% lower risk of all-cause mortality, cardiovascular disease, CVD, total cancer, diabetes and lung cancer. No association was found between muscle strengthening activities and the risk of some site-specific cancers, colon, kidney, bladder and pancreatic cancers. J-shaped associations with the maximum risk reduction, approximately 10 to 20%, at approximately 30 to 60 minutes per week of muscle strengthening activities were found for all-cause mortality, CVD and total cancer, whereas an L-shaped association showing a large risk reduction at up to 60 minutes per week of muscle strengthening activities was observed for diabetes. In the paper, the example of the muscle strengthening activities is resistance training. Combined muscle strengthening and aerobic activities, versus none, were associated with a lower risk of all-cause, CVD and total cancer mortality. The conclusion is muscle strengthening activities were inversely associated with the risk of all-cause mortality and major non-communicable diseases including CVD, total cancer, diabetes and lung cancer. However, the influence of a higher volume of muscle strengthening activities on all-cause mortality, CVD and total cancer is unclear when considering the observed J-shaped associations. The second is a research article titled, Long-Term Leisure Time Physical Activity Intensity and All-Cause and Cause-Specific Mortality, a prospective cohort of U.S. adults, published in the American Heart Association's journal, Circulation, by researchers at the Harvard School of Public Health. The research shows meeting the long-term leisure time MPA, 150-299 minutes, week, and VPA, 75 to 149 minutes, week, guideline was similarly associated with lower mortality, lower risk of all-cause, CVD, and non-CVD mortality. Compared with those meeting the long-term leisure time physical activity guidelines, participants who reported 2 to 4 times above the recommended minimum of long-term leisure time VPA, 150-299 minutes, week, or MPA, 300 to 599 minutes, week, showed 21% to 23% and 26% to 31% lower mortality, respectively. In the research, moderate physical activity, MPA, is the activities including walking, performing lower intensity exercise, weightlifting, and doing calisthenics. Vigorous physical activity, VPA, is the activities including jogging, running, swimming, bicycling, engaging in other aerobic exercises, playing squash, racquetball or tennis, working outdoors, and climbing stairs. Higher levels of either long-term leisure time VPA, is greater than or equal to 300 minutes, week, or MPA, is greater than or equal to 600 minutes, week, did not clearly show further lower all-cause, CVD, and non-CVD mortality or harm. In joint analyses, for individuals who reported less than 300 minutes, week of long-term leisure time MPA, additional leisure time VPA was associated with lower mortality. However, among those who reported as greater than or equal to 300 minutes, week of long-term leisure time MPA, additional leisure time VPA did not appear to be associated with lower mortality beyond MPA. It is worth noting that when the two studies were focused on resistance exercise, the conclusions were not so harmonious. I believe physical exercise are medicines. They have side effects. Every patient needs the right medicine. We still have too little research on the effects of exercise on the body. Further research is needed to reveal how to quantify the combination of these physical activities and how those physical activity combinations affect various age-related diseases.